All right. Well, today we are introducing the Art of Living Well, the series. So we are transitioning from Real Talk Wellness to the Art of Living Well because I just really truly believe it is an art to figuring out
Hmm.
to live in such a way where we're taking care of ourselves holistically, right? Spiritually, mentally,
Absolutely.
emotionally, financially, even all the things. And it takes some time and some support. And so, what I want to do with this series is invite different people that I've encountered that have particularly helped me in my wellness journey, and just hear from the experts. And so, today we have with us Dr. Yelena Okhotin.
You got it.
Did I
Both
get
names are hard, so you did both correctly.
Awesome, awesome. And my introduction to Dr. Yelena was through my own issue. So a lot of you know I had a knee injury from teaching Zumba a couple last year. It was almost a year ago. It's popping up in my memories. And I, was kind of shocked at my body. I'm 48, so I was 47 when this happened, and I was kind of shocked at how much pain I was in and how I wasn't bouncing back the way that I used to. And I was very nervous about like what was going to happen to me. Was this the beginning of the end for me? And I still feel so young, and I was like, I don't know what to do. And so I tried a lot of different things, and I saw several doctors, which is not my normal go to. But I did for this because it felt different. And I just was very disappointed with their advice and their suggestions. And it was basically like, this is your new normal. Stay off your leg as much as possible. Like, no, that's actually not what I'm gonna do. And so I had a lot of friends who specifically mentioned acupuncture. And so I also had a friend who had a bad acupuncture experience. So I was a little hesitant to try it, but I was also kind of desperate at the time. And so I started to do my research and started to get referrals from different people. And that led me to finding Dr. Yelena. And what a phenomenal experience. And I wanted you to hear from her what it is and how it works and why it works so well with the body. So welcome, Dr. Yelena. I'm so happy to have you here.
Thank
What
you. Thank you
what
for having me. I'm really excited to be here, Danny.
yes, I'm so excited to have you. I pitched this to her a year ago, and it's just now
I've been
just
sitting
now
with
getting
this
to
for a year.
she's like, I don't know, maybe. So I'm glad you took me up on it. So where are you originally from, and what led
Yeah.
you into the world of acupuncture and holistic, because you're in holistic medicine, yeah?
Yeah, yeah. So I was born in Ukraine. And so then we immigrated to Washington State. And so I immigrated when I was 2, and I was raised in an immigrant community. So I grew up speaking Russian. I didn't learn English until I was sent to kindergarten. Yeah, and I don't know if you know much about the Slavic community, but we are very holistically minded. So my parents basically raised us on herbs and diet, like a we had a garden, we had our own livestock, very pastoral. And so really we went to the doctor for like if we broke an arm, like something more serious, obviously the basic checks, but really like if even an ear infection, like we would get an antibiotic prescription, but we wouldn't fill it and we would do something at home. So that's just the way I was raised, and that's what I was always very familiar with. And so when I started thinking about what I wanted to do, nutrition was always what I wanted to do. And so I went to community college, I took a nutrition class, and it was terrible. I was like, what is this? Like, you're like, they don't recommend sauna, they don't recommend, like, they were so anti like raw milk. I mean, I grew up, we had a cow, like, we had a goat, we really lived off the land.
Yeah.
And everything was about calorie counting and low fat. And I was like, what in the world? Like, that
Interesting.
doesn't really make sense. And I mean, my nutrition teacher was just drinking like Diet Coke all day, like pep, like it was like not, it was not a reflection of health. And I was like, I don't know if I want to just go and learn this food pyramid because it
Mm.
doesn't feel like this is the answer. And so I was like, I got to go more. So I got to go to med school. So then I decided to go to med school. I got my bachelor's in biochemistry, and I was all set to, and I had chosen at that point to go to DO school to become an osteopath because that seemed more holistic to me. And then I had discovered naturopathic medicine during that time I was researching too. And I was like, well, that looks interesting and way more what I'm into. But the licensure just isn't there throughout America. And so I was like, DO seems like a safer route. Um, but anyways, long story short, I ended up going to naturopathic medical school. So I went there, and then when I was in school, I discovered acupuncture. So up until that point, I had never heard about acupuncture. I didn't know anyone who'd done it. I didn't know anything about it. And, I didn't grow up with a phone. So we did not grow up with social media. We didn't know anything really. So part of the requirement in school was to go to our teaching clinic and try different modalities. So we had Ayurveda, we had acupuncture, we had nutrition. And so I basically sampled different modalities, and acupuncture blew me away. You could picture me as a very type A, very intense, very task oriented 4.0 student. Like that was me. Like hard to like be around.
Well, there's but same. Get it? I totally get it.
And like I was just blown away. The acupuncture helped me with my digestion, with my neck pain, with my stress, with my sleep. And I just was like, why are they asking me all these questions? Like I'm here just like for this one thing. And
Right.
it's no, it's not one thing. It's all connected. And so I tried it. I really liked it. And I was like, you know what? Like why not? Like, why not add this to my degree and learn this as well? And as I do my naturopathic medicine consults with people, while like we're waiting for results to get extra movement, to get an extra tool in my toolbox, why don't I just study acupuncture? Even though it's such an unknown for me, and I really didn't know enough about it, but I have had mentors at school that had been doing it and they recommended it. And I was like, let me just do it. So I ended up adding on my master's in acupuncture, and I studied that, Chinese herbs. So I was in school for, I don't know,
Oh,
another
okay.
6.5, 7 years. So I graduated in 2020. So yeah, I have
Wow.
my doctorate in naturopathic medicine, my master's in acupuncture, and then I also studied Chinese herbs. So,
I love it. I love hearing the journey and
yep.
how so much of your upbringing
Mm-hmm.
impacted you. And I
Mm-hmm.
think that's kind of the reason why we have to have the conversations.
Mm-hmm.
Because here, if you were raised in
Mm-hmm.
the US, um, it's not like that. Our
Mm-mm.
diets are very different here.
Mm-hmm.
Um, especially like in the Black community, there are
Mm-hmm.
certain lifestyles that are just not, even though I feel like, our parents grew up
Mm-hmm.
a little bit more connected to the land, if you will.
Mm-hmm.
But in terms of like, it was just a hard, stressful life.
Mm-hmm.
This
Mm-hmm.
chronic stress has been passed down, and then our diets are
Mm-hmm.
trash. We're not able to, we don't know how to support ourselves. And so that's why to me it's so important that we have these kind of conversations to learn
Mm-hmm.
how to reverse some of this stuff because um, I've been studying the nervous system. Okay, so my experience, I came to you for
Mm-hmm.
my knee.
Mm-hmm. Mm-hmm.
And my very first, she did, did ask me a lot of questions. I was like, knee, let's focus on the knee.
Knee, do the knee.
Do the knee. Um, but I was, after my first appointment, I don't know if I shared this with you, but um, I was like, why do I feel like this?
Mm-hmm.
Like I was very, very calm, and I am not typically calm. I work very hard at trying to ground myself.
Mm-hmm.
I was so incredibly grounded and
Mm-hmm.
emotional. And I
Mm-hmm.
don't know why. Like I sat in my car and cried. Like I felt like it
Mm-hmm.
allowed me to release.
Mm-hmm.
I don't know if you can explain why.
Absolutely. Mm-hmm.
I was like, wow, this really is doing something to my nervous system.
Mm-hmm.
Unexpected,
Mm-hmm.
completely
Mm-hmm.
unexpected side benefit.
Mm-hmm.
But so tell us, like, what exactly is acupuncture? And then we'll get into the nervous system.
Mm-hmm. Mm-hmm. Yeah, and I just want to preface this by saying that if you ask me in a year, I'm probably going to have a more nuanced, a better response
Yeah.
because the more I practice, the more I read, the more I study, the more I learn, and the more I see how integrated it is and how complex it is, because this is a really like there's a lot of body of there's a long history here. This is not something that's been around 100 years, 200 years. It's been around 5,000 years.
Wow.
And so we don't even have a, we don't, can't even grasp that. Like we haven't even had antibiotics for what, 100 years? Like we can't literally grasp that. We, like all of our modern medicine, like we can fit that probably in what, 200, maybe 250 years. Like we can't grasp the length of time that this medicine has been around. And I was just listening to a lecture yesterday, and I loved this lecture because this was a medical doctor who got into the nitty-gritty science of the body and acupuncture and embryology. And it was like, it blew my mind because I had not been taught that in school. In school, I was taught very basics, just like pattern recognition but like the more time I spend doing this medicine, learning about this medicine, the more complex it is. So that's my preface.
Mhm.
But what is acupuncture? I mean, at the basics of it, like we're putting needles into points, and these points are points that have been used for a long time, have been found to be connected with different things, and they're put along different meridians and channels, and that's at the basics of what it is. And what we're doing is we're stimulating energy or chi and blood. So that's at the very basics of that.
Yeah.
And how does that work? I mean, that's the next question. Um,
Hmm.
it's complicated.
Yeah. Well, first of all, I just want to say a couple
Yeah.
things. The body is so inc in incredible, number one,
Hmm.
but it
Hmm.
also incredibly connected. I
Exactly.
think way more than I think
Hmm.
we
Hmm.
even
Hmm.
realize. Um, when I was doing my research, so I wanna also just kind of interject here. Um, I have been, in the world of like holistic health and
Hmm.
wellness for 8 years, and I've been open to it for a little bit longer. And
Hmm.
so, but I realize that I have to be careful because there are
Hmm.
extremes,
Hmm.
right? And in terms of like sometimes people incorporate spirituality
Hmm.
into it, but I like what you said. It is a science.
Hmm.
It truly acupuncture is a science, and our community here is very familiar
Hmm.
with essential oils, and sometimes people pull the spiritual aspect out of essential oils,
Hmm.
but it's chemistry, the way that it works
Hmm.
with the body. So I did a little research before I came to see you because I needed to
Hmm.
make sure that like this was a
Hmm.
science, and this is how AI ChatGPT kind of explained it to me. Tell me if this is like real basic. Tell me if it
Hmm.
makes sense. It's basically putting needles in certain points of the body, making a really, really tiny puncture, which
Hmm.
then signals to the body, we need to heal this.
Hmm.
And then the blood and everything comes there.
Hmm.
Healing cells, I don't know if that's an actual thing. I'm sure there's a name for it, comes and it starts to help the body heal on its own.
Hmm.
Okay.
Hmm. Hmm.
That's essentially what it's doing.
Yeah, I think that's a very kind of like a very basic way of understanding it
Mhm.
that can make sense. That makes sense to people. But I just want to add that there is another layer of complexity to that
For sure.
100%. Because even when you think about pain, like people can be like, well, you put the needle in and you release endorphins and that is pain relieving. So there's different ways you can try to understand that.
Mhm.
What I was also mentioning just earlier is that it's connected on channels, and
Mm.
it's now believed that that is the fascia. And so then you
Okay.
have these electrical signals that travel throughout the body along the fascia. If you have adhesions, if you're stuck at different places, that energy can stop and it won't move, that electrical current. And so that's why putting needles strategically in different places can help that overcome that blockage and allow that restoration of balance in the body. So, for example, this happens all of the time.
Mhm.
I put a needle in a point, and then they're telling me, oh, like now I feel that like I feel it like just like that sensation there, and I feel it like almost like in my hand now. Like I'm like, well, okay, well that's how the channel moves. So why don't I massage the hand where the
Mhm.
next point is and allow that energy to move, and then it goes away. Or they're laying there and then they're like, I put the hand, I point and whatever in the wrist and they feel it on their shoulder. I'm like, well, good. I mean, that's where the channel goes. And then they
Mhm.
feel it in their heart and they feel it in their head. I'm like, well, that's the channel. So
Mhm.
now I'm allowing people to make that connection for
For
themselves that
themselves.
you're connected.
Completely.
But if it's stuck, I either add another point just along that channel, just allow that to unblock.
Hmm. One question that
Yeah.
keeps coming up when I've been talking about acupuncture that a lot of people have is, does it hurt?
Mm. Hmm. Hmm.
You want to answer that?
Um, so there is a spectrum of styles and practitioners.
Okay.
Um, if I
Fair.
had to be 100% honest, if you went to China
Hmm.
and you got a treatment there, it may hurt. Like it may hurt. Because different depths, different techniques, they do different things. So it can. But like in America, what we are taught is not to make it hurt. Like
Hmm.
because you guys won't come back. Uh,
Right. We're built different here in the States.
exactly. So really like I gauge the patient, what their tolerance is. I can literally go so light that you won't feel a thing. But what we know now is that even a little puncture can shift the fascia. And
Mm-hmm.
that's all we need.
Yeah.
And so it really depends. But really, like when with my patients, no, like it doesn't really hurt. Maybe they might get like a strong sensation of energy there. But that's probably the only hurt that I would explain. Maybe I'll catch a nerve and that might be like a little tingle, and then I'll just move the needle because I can't see nerves, and those
Mhm.
superficial nerves are everywhere. So that'd probably be the extent of pain that you would
Yeah.
experience. Yeah.
Yeah, I will say I didn't feel the needle going in,
Hmm.
but you would like kind of like tap it,
Hmm.
and then I would feel like a sensation.
Exactly.
And it's funny because I think you were explaining to me what is that sensation? Because you want
Yeah.
you
Yeah, we
want
do. We do.
yeah.
We want circulation. Like your explanation of acupuncture, it's that circulation of blood and energy. So for your knee, when I treated you, I treated everything. Like I went off your pulses, I treated stress, all of it, but I also went locally to the knee to target the channels around the knee to get that energy flowing there and get
Yeah.
that blood moving and get that recirculation
But I
happening.
feel like the places where it was where I felt the biggest sensation was um they were all connected to my little stressful nervous system.
Yeah, yeah,
So
yeah.
that's where I could like really like, oh, whoa, I felt that. I really
Mm,
felt that.
hmm.
So why is the nervous system, I don't even know how to
Yeah.
ask that question, but
Hmm.
how does it support the nervous system?
Hmm. I mean, it's huge. I mean, every patient, I always check their pulses, and the pulses guide me and tell me what to do. So in the pulses, I'm feeling for 12 channels. I'm feeling for the 12 meridians. And depending on the consistency of the pulse, I can usually tell if someone's like really stressed, like consciously stressed, or if there's almost like a weakness and a blockage where like it's a deep stress. Like it's
Mm,
almost like the stress is so deep and long and great that it is restricting flow in every channel. So what I'll
mm,
feel is almost like a blockage throughout. And I'm like,
mm,
that's not normal. Like, because you're not, like, you're too young for this.
mhm, mhm, mhm,
And so then I'll always clear stress first because stress really is a root cause to
mhm,
illness. And I don't know what the number is. I think the number they say is what the root cause for what 90+% of diseases, stress is the root cause. And we have to clear that because you're wasting your energy.
mm,
You could be using that energy towards healing,
mm.
but
Yeah.
you're using it for your mind. You're using it for like to just survive. Like that, we gotta lower that. Like
Mhm,
we really need to clear that first. So I'll give you an example. I had a patient who has had chronic back pain for 20 years. 20 years. So I felt his pulse and I was like, oh my gosh, he's so stressed. So I just did one treatment for chronic stress, different from conscious stress, different from like an acute stress.
mhm.
Um, and he got off the table and he said his back pain was gone. It was gone. I didn't even put anything for his back. But when I put the needles in for that chronic stress, I could see his body was responding. I could see the
Like
redness around the
releasing
needles.
almost.
I could see his pulse shifting. It was coming back to life.
Mm,
And then I was like, well, I can't really do the back today because this is such a strong response.
mm-hmm,
And it shifted it.
mm,
And he didn't tell me that he had had trauma, that he had had all these things happen in his life. Like, he didn't tell me any of that. Like, but the pulse told me. And that
mm-hmm,
was enough to get a shift. So I always start with stress if stress is present in the pulse
mm-hmm.
because it really, I mean, yeah. And I always add stress in, even if like people say they're not stressed. If someone says
Right.
they're
I
not stressed,
think we're all stressed in
I
some
think,
way, shape, or form. And I think like so many women,
mm,
I just feel like we are far more. This was an example of a man, but I just feel like
mhm,
so many women, at least the people that I work with and that I'm around, tend to be stuck in this
yes.
like this
Mhm.
perpetual state of
Mhm.
stress. And
Mhm.
I just feel like it's normalized. It's like
Mhm.
we don't even try to address it because it's like everybody is stressed. Like why I don't even know if that's the question you can answer, but like, why do you think that this is the case? Because it's manifesting itself, right?
Mhm.
And so many
Mhm.
physically, mentally, emotionally, like it's manifesting,
Mhm.
but it's like a cycle.
Mhm. Yeah. Well, because what happens is you could think about it like some of us are a little stickier. Some of us hold on to stress just a little bit. We're a little more sensitive. We pick up on things a little bit more like, like we're women are just so emotional. Like, guys are just like, whatever. I mean,
Right.
she said it because she said it. Like, who cares? And I'm like,
Right.
no, no, there's a deeper meaning here. It's
Hmm.
like
Hmm.
so I think some of us are just a little stickier and then we just stick on, and then we don't even realize how much we've accumulated through our
Hmm.
lifetime. And unfortunately, when you have a lot of internal stress, you try to mask that with more stress. And so, because that's something you can control, but then like the problem is, this is a big passion of mine. If you have something that's unresolved, trauma, something happened to you, and you haven't resolved it,
Hmm.
you think just because it happened a long time ago, it's gone. No, there's no like little age limit in the brain. It's like, oh, well, this was when I was 5 or 10. Like, no, it's present because you haven't dealt with it.
Hmm.
It's still
Hmm.
there.
Hmm.
And we try to ignore that and we try to cover that. And that's the problem. So
Hmm.
really working with people's layers, one layer, another layer, another layer, another layer. And it's just, I mean, that's the beauty of it. That's the art of it. That's what's exciting. But it's complicated.
It's so
Yeah,
complicated and so layered. It's so layered.
exactly.
When you say resolved, are you suggesting that you can resolve past trauma through acupuncture?
I've seen it. I've
Really?
seen it. I've seen it help. Yeah, I mean, I have patients that tell me that this acupuncture was more helpful than therapy,
Mm.
you know?
Yeah. Because it's
And
moving it. It's like moving it.
there comes a point where you just keep getting in a loop and you just keep saying the same thing over and over and over again.
Hmm. Hmm.
And we need to break that loop.
Yeah. Hmm.
And in Chinese medicine, they believe that these organs have emotions associated with
Right.
the organs. And so, yeah, it's all connected.
Hmm.
Yeah.
Fascinating.
hmm I'm
Fascinating.
not saying it's the only way,
For
but I'm
sure. No, no,
saying
no. I was just
it's a
wondering when you say
tool,
to
a
release
tool.
it, yeah,
Yeah.
that
Yeah.
it's a tool. I
Tool.
think there's a lot of different modalities, which is what I hope to introduce people
And
to.
and can we 100% resolve? I mean, on this earth, I don't know. I
Right.
mean, we could just help and we can
Right.
try
So we
to
can
like,
function
yes, yes.
and have a measure of
Exactly.
peace in this
hmm
crazy hectic world
hmm
that we live in. Yes.
hmm
All right, I'm gonna shift the conversation here just a little bit because I could talk about this all day and all night. But
I know. I was like, you gave me 30 minutes. We'll see.
we'll see how that goes. Um, can we talk about hormones just a little bit?
About what?
Hormones,
Hormones. Okay.
and how acupuncture can help. Most of the women on this call and that will be listening to the replay are 40 plus. So we're perimenopausal, postmenopausal. You feel like you're flipping going insane because your
Mm-hmm.
body is just like, oh, we're not doing that no more. That used to work. Yeah,
Mm-hmm.
not anymore. Right. So we start to feel these different things, and you feel like you are. And I know for personally, I feel like, who am I? Who are
Mm-hmm.
you?
Mm-hmm.
How does can acupuncture support those what do you call those?
Fluctuations.
Yes,
Mm-hmm.
fluctuations in hormones.
Mm-hmm. Mm-hmm. I think we're nearing the topic of menopause, right?
Yes.
Okay.
Yes.
Just to start off by saying, like, Chinese medicine doesn't have the word menopause. I mean, what they have is the end of your menstrual cycle, but they don't, like, for them, it's just the next step. And so, really, I think in our society, it's become this big deal. But I
Mm,
do think that it has to do with a lack of balance that
mm,
has led up to this point.
mm,
So in Chinese medicine, for women, things are seen in cycles of seven as big major hormonal shifts in the body. So age seven, puberty, no, age seven, and then age 14, puberty, like menstrual cycle, 20, 20. Oh my gosh, now I'm doing math for 24. What I want to get to
I can't help
is
you.
is age 35. So
Mm,
35 is kind of when that natural decline
mm,
in energy starts to happen, in our reproductive energy. And then we hit 7 times 6 is 42. Then we hit 49, 7 times 7. And that's when you start seeing these major shifts in our health. And so my teacher always said, how you your problems start to show up in these life phases. So
mm,
if your period is painful, irregular, you have PMS, that needs to be fixed so that you
mm,
have an easier transition into perimenopause, into menopause. And so, really, it's about balance.
mhm,
And so, around menopause time, you have this prime opportunity to restore balance
mm.
so that into the next life phase, you enter it with more balance and health. And so, really, this whole system is about balance. I don't have a hormone point. Yes, there are endocrine points. Like, yes, absolutely. But really, I'm treating the person.
So balance
So, like,
in what way?
Like, for example, the main channels that have to do with hormonal balance in the body would probably be liver. And so that's correlated with stress, with detoxification, with lymphatic circulation. Hormonal processing is huge for the liver.
Mhm,
So that is one way. And some people really get stuck in that system. For others, it's going to be blood and like a lack of nourishment, a lack of energy. So then I'd focus on the spleen, I'd focus on lungs. And then another one would be kidney. That's probably the biggest one that matters the most in menopause because that's when your kidney energy starts to decline. And your kidney energy is your reserve. You were born with a certain amount given from your parents, and then the way you live your life can kind of burn through that reserve. And we really start to feel that once we hit that perimenopause, menopause time.
fascinating.
Yeah, sorry. I know it's like I'm trying to summarize like 10 years of like
No,
information
no,
in
I
like a
mean it's
sentence.
no, I mean, so you're just talking about so basically what I'm hearing
Yeah.
is the our lifestyle
Yes. Mm-hmm.
um impacts the balance of
Mm-hmm.
energy, blood flow
Mm-hmm.
in our body,
Mm-hmm.
which then could negatively or
Mm-hmm.
positively impact the fluctuations in hormones.
Mm-hmm. Yep. Yeah.
That's what you're saying.
And really what's better is for you to come in and get preventative
Right.
treatment than us have you coming in and us putting out a fire. Like that's really the best. And that's the way to age gracefully and to age in a way where you're not having the erraticness of those symptoms. And
Interesting.
I also want to include herbs here too. Acupuncture is helpful, but herbs work in congruence and can be very helpful as well.
Yeah.
Yeah.
Yes.
Mm-hmm.
And this group are we use a lot of essential oils
Mm-hmm.
and herbs. So I think
Mm-hmm.
I see all of this just
Mm-hmm.
kind of coming. together to support the body in finding that balance.
Mm-hmm.
Um, hmm, this is, you know, we just in this society, I don't know
Mm-hmm.
if, you know, the people that are joining us live feel me, but like we normalize a lot. We truly normalize a lot.
Mm-hmm.
We normalize painful periods. We
Mm-hmm.
normalize like I see people talking about hot flashes like on social media a lot and like it's a joke. And it's like actually, no, I don't think it's funny. Number one,
Mm-hmm.
I have also in my own, like, I am very in tune with when
Mm-hmm.
I do get a hot flash and what I have
Mm-hmm.
done in the days prior. And I started researching, and caffeine, hello,
Mm-hmm.
is a
Mm-hmm.
huge trigger for hot flashes in this season of life. That's a, to
Mm-hmm.
me, very simple, easy lifestyle change. Like, we don't have to be dealing with these very dramatic symptoms.
Mm-hmm.
You know, to me, there is a way to really support the body so
Mm-hmm.
that it isn't so vocal. I
Mm-hmm.
mean, I don't know your
Yes.
thoughts on that.
Yeah, I pulled this up before our call because I just kind of woke up with this thought where I was like, you know what? Like acupuncture has been around for so long, and all of these modern medicine interventions that we are currently using are new. I mean, they're new. They're not that old. They're a couple generations old. Like, let's see here. What do we have here? Bioidentical hormones, 20, 30 years. Hormone replacement therapy, 70 to 80 years. Um, like these things have not been in use for a long time. Like this has, like people have gone through menopause for a long
Right.
time, forever.
Right. Forever. Forever.
So the medicalization that we're doing now for a natural progression,
Hmm.
I mean, it's extreme. It is extreme. And I really wonder the sustainability of that.
Oh, for
I
sure.
really wonder.
And what the long-term
I
effects.
wonder.
Yeah.
I mean, I
Right.
have people coming in all the time who are like waking up at 4 a.m. to work out and then their kids getting to school and like they work full long hours and then they go to bed late. They get 5, 6 hours of sleep. Some even wake up in the middle of the night to go clean. Like I just and they're like, "Can you help me do that? Continue to do that?" I'm like, "Okay, like I'll help. I guess I'll help as much as I can, but truly, like you are working so hard and you are not giving yourself time for rest, for proper nourishment. Like like I'm not like you can't really treat it in that way. Like
Right.
optimize me. Optimize
Right.
me so that I
Well,
can continue this insane lifestyle that
right.
my body is not designed for, so I can survive in the modern society."
Yeah. And I think that is to me like this culture that we live in.
Yeah.
Just give me a pill. Just give
Hmm.
me a pill or,
Hmm.
you know, a shot or this or that, and that will fix the problem as instead of actually looking at the way we lead our lives
Hmm.
and really trying to make decisions on the day to day that will help us be well and
Hmm.
support our bodies, right? We
Hmm.
have to support our bodies and not like press them to the limits. Man,
Hmm. Hmm.
there's a lot. We didn't even get through half of the questions. We didn't even get through half of the questions. But I do want to just ask one last question and then we'll
Hmm.
open it up for Q&A and cut the recording. But
Hmm.
I want to what would you say to someone who I believe that acupuncture should be and could be a part of almost any
Hmm.
um
Hmm.
treatment protocol. I don't know
Hmm.
if that's the right word, but no matter what you're dealing with, I truly believe acupuncture could be inserted in there and will just
Hmm.
only help, right?
Hmm.
That's my take on it. But for those that feel nervous or
Hmm.
skeptical for whatever reason, maybe it's like it's too woo-woo, right? They can't
Hmm.
really wrap
Hmm.
their brain around it, or I mean, it's gonna hurt. Like, what
Hmm.
would you say to someone like that?
Like you said, you did your research. There are different practitioners, there's different styles. Find someone that you resonate with because there are different styles. There are. Like personally for me, I just take a very logical route to it. I am extremely logical. I'm like, I feel this in the pulse. Now I did this point and it feels better. Awesome. Like the pulse is feeling great. Great, I'm done. Like that really is my entire metrics. Like I really, and then there's a shift in the patient and there's a shift in everything. Like They feel sensation, like I'm good. Like that is that's my approach. So find the right practitioner. And I usually ask my patients to give me 3 sessions because I just don't feel like one is enough. Especially if you've never had it before, and say you do have an emotional release and a response. And there is the possibility that you may feel a little worse before you feel better. If you do have an emotional response after acupuncture, that could be uncomfortable. And so usually like treatment 2, treatment 3, you're good, you know? So, but that first one, I really do ask that people give it a couple more.
Mhm.
Yeah.
Yeah.
Mm-hmm.
I think that's fair. And
Mm-hmm.
I don't know if you still offer this, Dr. Elena, but I think how I decided, a lot of people gave me recommendations for their acupuncturist, and I am a let's test our chemistry before
Mm-hmm.
I spend money on something. I don't know if you still offer this, but we did a virtual,
Mm-hmm. Mm-hmm.
just a short virtual consultation, and I was like, okay, yeah,
I did. Yeah,
I
I
can,
still
yeah,
do that. Mm-hmm.
yeah. I think that's important. So you can make sure you connect with the person.
Mm-hmm.
Um, but yeah, this is good. And I just one last one. I know I said this last question, but last question. What are just in addition to acupuncture,
Mm-hmm.
to essential oils, to herbs, what are some other very simple ways that we women of a certain age with busy, hectic lives that we can support our bodies, support our the balance within our bodies as a whole?
Hmm. Um, I think I'm gonna go back to lifestyle and just kind of evaluating what is on your plate, and really kind of just reevaluating what is essential, what is not essential, where can I say yes or no? Like, just saying no to something just releases some energy there. And like, if you say no and you're like, oh, I feel better, like, well, there's your sign. Like,
Yeah.
like that clearly was draining you just thinking about it, much
Mhm.
less doing it.
Right.
So I,
It's so simple that I feel like what you just said is so simple that we dismiss it.
yeah,
Just
yeah.
evaluate what's on the plate.
Hmm.
Yay, nay, release.
Hmm.
So
Today, I
yeah.
had a patient that I sent her home with this message. I was like, okay, great. Like, we'll see you in a couple weeks. Awesome. Like, I'm glad it's helping. She feels amazing. But I'm like, if you want it to last longer, I challenge you, a mini challenge, to just reevaluate your lifestyle.
Mm,
See if you can like go outside and read a book. See if you can go to bed 30 minutes early. See if you can say no to something. Just try, okay? Like, let's see if we can push you out to 3 weeks, okay? Like, maybe
right.
4 weeks. Like,
Yeah.
if you want this benefit to last longer, you're gonna have to shift something in
Mm,
your lifestyle.
mhm,
So
mm.
just a mini little challenge there.
So good. Ah, so very good. We needed this. All right. Well, I thank you guys for watching, and we'll be back next month with a different topic. Thank you so much, Dr. Yelena.
You're welcome. You're
And
welcome.
we're gonna open it up for a little Q&A.